Yes, that is called a MIC cannula for minimally invasive central aortic perfusion that has been designed from me, Francesco Pollari. I'm an adult cardiac surgeon, and my colleague Michela Cuomo, she is a pediatric cardiac surgeon. We all know the state of the heart in field of aortic perfusion that consists mainly of two types of cannula. The standard cannula on the left for the direct aortic cannulation that allow antegrade perfusion, and the minimal invasive alternative, the short cannula that mainly is placed in the femoral artery. But we should be aware also of the problem of the heart. For the first type is intuitive, so the standard cannula needs the opening of the chest and the direct manipulation of the aorta that could be bring to bleeding. For the second type, there are also some problems. For example, in some studies has been found that the retrograde perfusion be associated with neurological events, but there is also some other complications that is called upper body hypoxemia or Harlequin syndrome for some colleagues. Especially in case of residual cardiac activity, the supraaortic vessels become more deoxygenated blood from the heart than oxygenated blood from the cannula. And that occurs not only during ECMO or ACLS, but also during a normal, standard elective, minimal invasive valve surgery. As you can see here, there are the NIRS measurement and showing a deoxygenation of the head at the beginning, at the end of the cardiopulmonary bypass. Starting from this problem of the heart, we designed our own cannula, that is the MIC cannula. And here you can see the main characteristics. This cannula is inserted through the femoral artery as well as the state of the heart, but is long enough to reach the aortic arch and to allow the antegrade perfusion. It has a max diameter of 16 up to 18 French, and that allows the removal without surgery or with the use of standard vascular closure devices. She is equipped with an introducer that is flexible enough to allow the overcoming of the iliac artery, and is equipped with radiopaque markers to facilitate, if necessary, the fluoroscopic placement. And the distal extremity is provided with perforations and has a curved shape to respect the anatomy of the arc. Here you can see how should it works the perfusion. On the left you see the retrograde perfusion bringing to Harlequin syndrome. You see the abdominal organs are red and the head is deoxygenated. And on the right you see how should it perform the perfusion, antegrade perfusion with the MIC cannula. That is not only speculative. That has been proved from colleagues in Aachen that has performed a computational fluid dynamic analysis and found that such a perfusion would result in optimal oxygenation of the upper body. Interestingly, the colleagues that recently published this work in perfusion were totally not aware that we have already patented the cannula. That was a long road to the patent, has begun at the beginning of 2019 with the application for international patent. In 2021, we received the positive IPR, and only in August, the patent was granted from European Patent Office, and last week was finally published on the European Bulletin. Here you can see, and that is the last slide, the wide applications of this kind of cannula. It could be used in cardiology for support patients in cardiogenic shock or sudden arrest, but also to manage some complication of some challenging elective PCI that results in low cardiac output. It could be used also as well in cardiac surgery, theoretically in every cardiopulmonary bypass time, but obviously it is more suitable for the minimal invasive. And we have seen how in the morning how many different minimal invasive settings there is in cardiac surgery, for example, robotic. But finally, also in intensive medicine, in ICU, for example, excluding the cardiogenic shock also for severe respiratory distress. And for example, it could allow the pronation of the patients without any risk of dislocation of a cannula, for example, in subclavian. To conclude, the MIC cannula is a new patented medical device aiming to allow a more natural and physiological arterial perfusion, to reduce the invasiveness at the same time, to extend the possibility of treatment in centers also without a cardiac surgery on site, and to improve the outcomes of minimal invasive cardiac surgery as well. Thank you very much for your attention.